Hello guys, I'm Kerry for those who don't know me. Guys, today I'm going to drop a video about postpartum hemorrhage. Guys, before I start the video, kindly do subscribe to my YouTube channel, like this video, share it guys. So, I'm going to start by the definition of postpartum hemorrhage. So the definition is, it is an excessive bleeding that occurs within 24 hours after delivery. And also we have to, for the delivery, somebody can go to SVD, that is spontaneous vaginal delivery, and also we have those who undergo for the cesarean section. Any blood loss of more than 500 mils of blood, it is considered to be called postpartum hemorrhage. Guys, we have the two classification of postpartum hemorrhage. We have the primary classification of the primary postpartum hemorrhage and the secondary postpartum hemorrhage. The primary occurs within 24 hours of delivery, and for the secondary, it occurs during 24 hours of delivery up to 6 weeks of delivery. That is excessive bleeding within 24 hours of delivery up to 6 weeks of delivery. And then we have the risk factor for postpartum hemorrhage. The risk factors for postpartum hemorrhage, number one, we have the multiparous. Multiparous are those people with a lot of children who have given birth to so many children, all a number of times. And also we have those people, the pregravid also. The pregravid are at risk for postpartum hemorrhage. And also age matters a lot. Any woman more than that 5 years of age is likely to get the postpartum hemorrhage during delivery. Now we have the causes of postpartum hemorrhage. The causes, we have the 40s. We use the 40s for the remembrance. So for number one, it is the tears. If there is any perineal tear, cervical tears, can lead to postpartum hemorrhage. And then we have the tonic of the uterus. If the uterus has not kurudi what after delivery, the uterus inafaa irudi vizuri. If that uterus it has not reversed back, it can lead to postpartum hemorrhage. And also we have the thrombing factor. Those people who don't have the clotting factor are at risk for postpartum hemorrhage. And also we have the the tissue retained, like the placenta retained. If you have given delivery and the placenta has not come out, you are likely to get the postpartum hemorrhage. And then now we go to the management of postpartum hemorrhage. Okay, number one, you call for help. If you are alone, make sure you call for other medics to come and help you. You can't manage it alone. Number two, you have to resuscitate the patient by giving IV fluids, intravenous fluids. The patient has bled, so you have to rehydrate the patient. Also, you have to do the GXM, that is blood grouping and cross matching. If the patient is anemic, like she has an HP of less than 5, you have to give blood to the patient. And also sometimes the infection also can trigger during the postpartum hemorrhage, like if you are going to do the manual removal of the placenta, so you have to give the antibiotic to the patient to avoid the secondary infection. And then also you have to give for those people who don't have the clotting factor, you have to give the vitamin K for them to contain the blood. That vitamin K is for the clotting factor. And also you have also to repair if the patient has any tear, any cervical tear. You have to stitch, you have to suture the tears also. That is about the management of postpartum hemorrhage. If you know that the management, kindly guys comment below on the section and the comment section. Now we go to the complication of postpartum hemorrhage. The complication number one, death. That is the obvious complication. If the patient is not well managed, the patient dies. Number two, you have to avoid that loss. You have to monitor your patient very well, like no any pregnant woman should die during the delivery. So you have to resuscitate the patient. You have to give all your knowledge that you were taught in school for you to retain the life. Also you have to save them. Number 2, anemia. Anemia is another complication due to the loss of blood. People lose a lot of blood, so you have to, and anemia it is a complication. Number 3, we have the secondary infection. In the secondary infection, if that patient is not well managed, she can end up having the secondary infection. So you have to treat, and that is the complication for the postpartum hemorrhage. And guys, that is the end of the video. Kindly don't forget to like the video and share it. Bye bye.